We will start the hearing now for HB 265, Delegate Guyton. And your witnesses can come up. I have Brian Pugh, Martin Kerrigan, and Catherine Carter.
Thank you so much, Madam Chair. Members of the Ways and Means Committee, it is very strange for me to be on this side, but it's lovely to see all you beautiful people moved around to the front, so congrats to all of you.
Another former member, welcome back.
You will see me, you will feel like I never left this session. So for the record, Delegate Michelle Guyton, Baltimore County District 42B, and I am pleased to be here before you today to ask for a favorable report on House Bill 265, designed to add an advisory panel to the Maryland Consortium on Coordinated Community Supports. This bill did pass this committee and the House last session, did not make it out of the Senate. There was some concerns about an amendment that was added that I voted for in this committee. But I do hope that this committee is mindful of that history as we hopefully move forward this year. I think we have a clear path in the Senate. I do have a cross-file in the Senate as well, Senator Karen Lewis-Young. So the members of this advisory panel established by House Bill 265 will assist the consortium. The consortium already exists. It was part of the blueprint plan in their task to develop standardized guidelines for our county boards regarding the information to be collected when students actually register for school, right? These questionnaires are already in existence. Every single one of our school systems is already collecting this information when a student registers to come to their programs, but the information that they're collecting is very different, right? Some of them are extremely extensive, like Baltimore County, which covers every sort of disability and issue that you might need to know about if you are a teacher or an administrator. And some of the other counties only have, a line that says, is there anything you want us to know about your child, right? You're not getting at the same information. So the reason that this was put in place for the consortium was that this information really is dramatically different, and it also affects the allocation of resources to each county. So the consortium on coordinated community supports, when it was established partly to remedy this situation. So this bill before you today, though, does nothing to change that. All this bill does is put into place a health advisory board to advise this already in place consortium when making recommendations about the topics to be included on this already statutorily necessary questionnaire. Right? The local boards still have all the autonomy that they love to write their own questions and administer the questionnaire as they deem fit. So the members being added through this legislation are subject experts in various disabilities, and the reason they're added and not already included is that these disabilities may mask behavioral and mental health issues, or they may be mistaken for them. And so why is that important that we know what those are? So if you work in the autism community, like I have for much of my career, you know that often kids with hearing loss can be initially diagnosed with autism or vice versa because they're not communicating well, right? Those require very different supports through the school system. Those with vision impairment might be diagnosed with a learning disability or dyslexia when in fact they may just need glasses. So we're trying to avoid those sorts of situations with this addition of the advisory group. So finally, it's a simple bill by expanding the expertise to advise the consortium, and the consortium can decide whether to take that advice or not. We capture more accurate data, and we support the needs of our diverse student population much better. So in addition to that change, this bill makes a technical change which was suggested last year in consultation with Rachel Heiss and the leadership of the Blueprint Commission to clarify that the screening that's already referenced in the Blueprint Consortium legislation is actually referring to a questionnaire. So there are some questions about that, and that was just to clarify the intent of the original legislation. Right? And this also adds a data privacy expert to this group because that is always a concern in this body. So I ask for your favorable support of House Bill 265. And I just want to point out that we have the support of many different organizations: Maryland Department of Health, National Alliance Mental Illness, Maryland Psychology Association, School Psychologists, Kennedy Krieger, Parent Advocacy Consortium, Band Self, on and on. Most of the favorable with amendments that you'll see in your letters, I have had conversations with them, and mostly they are being suggested because there's a misunderstanding about the scope of this bill. I am in agreement with so many of those suggestions, but I do not believe this is a good vehicle for those. So I'm happy to take questions and turn it over to my panel.
Thank you, Delegate. The next person can begin.
Hi, my name is Catherine Carter. I am a mom of 5 and vision and health advocate. And I'm here today because I'm asking for a favorable vote because the bill creates guidelines for the current student health questionnaires that parents answer when they register their students, and allows parents to update their student health information annually because their health changes. Several school districts use these questionnaires to connect students to need in local resources, programs, and partnerships. And I think it's always best when you have a visual. So if you look in the back of my testimony, I went and gave you screenshots of what's currently happening and how it's really all over the place. And that can be very limiting. If you ask not the right questions, you won't always get the right answers. So you see the questionnaires vary greatly among the school districts in the back of my testimony, and it can result in significant inequality, and this bill allows parents to ask for help and standardizes the questions that can support the work of the blueprint. You know, at the same time that I am asked every year to update my emergency contacts and any other information, I also will be given the opportunity as a parent to effectively update my students' health information with a standardized questionnaire developed by experts. You know, this is going to help kids like my son Atticus, who struggled for years, misdiagnosed and getting the wrong supports, or my daughter, where I couldn't really find a local provider and the school helped to connect me to one to support her IEP goals. And in addition, I want you guys to be aware, as a parent, this will empower me to not only educate the school, but educate myself as a parent, because we've all been newbies and we don't always know what to tell the school. So it will help inform parents on what the school needs in the student file to assist the schools in providing the needed supports and services. I'm asking you to please consider this vote because we've all been parents and we all are trying to figure it out with our kids, and giving a quality, expertly developed questionnaire can not only help us, but our schools. Thank you.
Thank you so much.
Good afternoon, Vice Chair Wilkins and members of this committee. My name is Brian Pugh, representing the Brain Injury Association of Maryland. For 40 years, our organization has been providing information, assistance, education, and advocacy to address the needs of the over 120,000 Marylanders living with brain injuries and the families and healthcare providers who serve them. We are here to ask this committee to give a favorable report to HB 265. A brain injury in childhood can have lifelong consequences for both the child and their family. Symptoms and the impact of brain injury are vary based on the part of the brain injured, the severity of injury, and the age of development of the child. HB 265 seeks to provide questions to help identify students with behavioral service needs like those that can be created by a brain injury, such as cognitive impairment. Brain injuries can cause cognitive impairments like memory issues, problem solving, and attention deficit disorders. These impairments can lead to issues with daily functioning, social interaction, and academic performance. Emotional issues. Brain injuries can lead to emotional difficulties such as depression, anxiety, and difficulty regulating emotions. These emotional issues can affect behavior such as causing difficulty in social interactions and managing relationships. Impulsivity. Impulsivity can be an issue for those with brain injuries, which can lead to behaviors that are inappropriate or dangerous. It can be difficult for these individuals to control their impulses, and this can lead to further social and behavioral issues. HB 265 is a step towards ensuring that all of our children have a chance to get the behavioral services they need to become the best versions of themselves, and we ask this committee to give a favorable report to HB 265.
Thank you so much.
I hope I don't break it. Hi, good afternoon. My name is Martin Carrigan. I've been a special education teacher in Maryland for over 20 years. I also serve as the chairperson of the Maryland State Traumatic Brain Injury Advisory Board. I have a master's and postgraduate degree in special education with an emphasis on acquired brain injury. I'm here today to offer support for House Bill 265, the development and implementation of a standardized behavioral health questionnaire for students. I've submitted a written testimony. I submitted it late, so you might not have gotten it yet. I have no problem sending it to everybody. That has some data and statistics in it. You can read that data, and you may already be somewhat aware of what it says. The bottom line is that students with behavioral health concerns and brain injuries are greatly underrecognized in our Maryland schools. So instead of repeating statistics that I've already submitted in written testimony, I'd like to share the stories of two different students that I've worked with in my career. The first student was a young man whom I met when I was working at a residential facility for students with emotional disturbances. This young man came to the school with a lot of difficulty regulating and controlling his emotions and behavior. He had extreme difficulties controlling himself and could best be described as all over the place. While sitting in his treatment team and reviewing his academic and medical files, I saw it documented that this young man had been riding on the back of a moped and had fallen off and hit his head. In a matter of a couple months, the student was now in the most restrictive locked door placement in the state of Maryland. Originally, he had been living at home with his family and was going to his regular home school. This means that every placement the student went to felt they could not educate this young man. When I brought up the possibility of a brain injury being the cause of the student's difficulties, the treatment team was like, oh, and it was the first mention of the student having a brain injury in all the records, other than the description of him falling off the back of the moped. The second student I would like to tell you about is a young lady who sustained several serious concussions as a middle schooler. Even though the student was diagnosed with and treated for concussions, her school was resistant to provide interventions and supports. Fortunately for this young lady, she had a fierce advocate in her mother, who happened to be a social worker. Because her mother had the proof and knowledge of the daughter's brain injury, she was able to get the right interventions and services for her daughter, who has now since gone on to college and earned a degree. The Centers for Disease Control and Prevention calls traumatic brain injury the silent epidemic. It is one of the leading, if not the leading, causes of death and disability in school-aged children.
Sir, I'm sorry if you can just finish up your final sentence.
Just thank you for your time and consideration for a favorable report for House Bill 265. Thank you.
Thank you so much, and thank you for everyone who came to testify. We do appreciate it. Questions from colleagues? Delegate Wu.
Thank you, Madam Chair. So thank you, Delegate Guten. And since I saw somebody I'm familiar from Howard County, I want to ask a question. I used to see you a lot on school board. So Ms. Carter, one question for you. This is actually nothing new, right? You should have put the recommendation together from professionals. Is that right?
One thing I've learned in Annapolis, you guys get a lot of requests for committees and commissions and stuff, and having been a member of the Strong Schools and the American Education Coalition, I thought the consortium had a large amount of those experts, so it wouldn't, and the process was already there. So it's already there, there's less work and less committees.
Great, thank you, Delegate. Any other questions? Seeing none, this ends the hearing on HB 265.